Hello everyone. Yes. I'm not going to use the entire talk, I am loud enough, but just need to get your attention. So, hello everyone, I hope you can hear me. I am Amy Ferguson. If you have not met me already, I'm sure you have received my many emails about the Circadian Mental Health Network over these past couple of years. If you haven't been receiving my emails, you're not on the mailing list and you should email me. So I'm going to talk today about the Mental Health and the Body Clock, a priority setting partnership that we have been working very hard on for the last 18 months or so. So, we've seen this slide quite a few times in this conference so far. What I'm going to be focusing on is objective number 1, setting the research agenda for mental health and circadian science. We want to identify the research priorities that feel most important to the experts in the area, and that includes people with lived experience of mental health difficulties and circadian disruption. So, to do that, we were working with the James Lind Alliance on a priority setting partnership. We also worked with McPinn Foundation to make sure that we had the voices of lived experience individuals heard in both the PSP itself, but also across the network and a lot of the other bits and pieces that we have been doing. One of the main things we were doing was using a public survey to find out what questions do people actually have about circadian rhythms, little bit of sleep boost. As you can see, it's hard to kind of disentangle sleep and mental health. And the aim was to create a list of the top 10 research priorities according to individuals with lived experiences, carers and clinicians, and to share this list with the wider research community. And you're all a very lucky audience because this is going to be the first public viewing of the top 10 research priorities for mental health and body clock. Told you didn't want to miss this. So, if you're not familiar with James Lind Alliance, they are funded by the NIHR, can't speak for them, a UK-based initiative, and basically the aim of what they're trying to do is bring together people so that they can set priorities for research across the board. They have lots of different PSPs they've already done in lots of different areas. And their aim is to make sure that we are hearing from people who use healthcare services, carers, families, other support systems, health and social care professionals across the board. So, why are we doing a PSP in the first place? Well, most commonly the people that actually make the decisions about what gets done in research are the researchers, the research funders, and the big scary pharma companies normally. So the aim of the PSP is to make sure that the priorities of people who are actually using healthcare services, people who have the experience of all these things, are the people that are actually being involved in what research is looking at, as well as people that are involved in caring and treating. It should be their research priorities. So, you're going to get sick of this slide. I'm going to come back to it quite a lot, but there was a lot involved in what a PSP is all about, but I'll take you through it step by step. So, our first thing that we were going to do is, first of all, what do people actually want to know? We don't know, so we had to do a survey to find out. So a survey of individuals with lived experience, family, carers, clinicians, anybody that has had experience of mental health difficulties and or circadian rhythm disruption. We did this with a fantastic steering group that we went back and forth with. Our steering group was comprised of people with lived experiences, clinicians, some of which also have lived experience of circadian rhythm disruption, given all the shift work that we do. So we had a bit of a kind of mixed group, as well as people that support everyone as well. So with our first survey, this is a paper version of this. Hopefully some of you are a little bit familiar with the survey. Hopefully some people actually filled it out. And if you didn't, why? This is important. Anyway, we shared the survey wherever we could get our hands on. Obviously we shared it across the Circadian Mental Health Network, but we had fantastic partners with Bipolar Scotland, with Mental Health, with McPinn Foundation, with BioClocks UK. We had 1 million people, thankfully, not a million, because we had 1 million responses, but we had lots of people wanting to be involved in this process and sharing out this survey. So, who did we actually get answers from? In this first survey, we got 274 responses. So we had to exclude a few people that were not in the UK. Unfortunately, we could only really comment on situations in the UK, so this was a UK only survey. Most of the people that answered had some experience of mental health difficulties or mental health condition, disrupted body clock through things like shift work or jet lag or other disruptions, and other disruptions of body clock that included things like sleep disturbances and other disturbances of their day-to-day rhythms. We also had quite a lot of people that identified as supporting individuals with those experiences. We had people answering all the way from 12, nobody less than 11 was allowed to join in, so we had 12 to 95 answering our survey. The 95-year-old did send theirs via the paper version. But we did kind of cover mostly was round about kind of middle age, 30s and 40s. As with most of these kind of surveys, the majority of the people that answered were women. We did manage to cover a good chunk of the UK, so we went all the way down from Devon, all the way up to Moray. And we got a bit of a range of the UK population, not completely representative, but we did our best. So, now that we actually have our first survey, what's next? Well, we had to kind of figure out what questions people asked. We had to actually have a look at what the people said in the first survey. We were then trying to combine those questions into something that's understandable to everyone, something that might constitute a research question in the future. And again, that was a lot of feedback from our steering group to do that one. So, in order to review the responses, we looked at the primary responses from the survey. So we had 274 people. But that actually ended up with 964 different questions. Yeah, it's quite a lot. At one point, I gave up counting after 500. I then eventually counted. We do have 964 questions is what we ended up with. We had to exclude out of scope responses, so some really specific geographical locations, so like my GP in XYZ said this. Things like that we had to get rid of. Anything asking about really specific sleep disorders that we couldn't deal with, unfortunately, I think our scope was broad enough. I don't think we could really cover absolutely everything we could as much as we wanted to. So we then collected those in-scope questions into different themes, and given the broad scope of what was going on, we ended up with 69 different themes of questions that people were asking about. And we tried to combine as many of those different questions, similar questions, to create our summary questions. And we ended up with 228. We cannot rank 228 questions. We cannot ask people to read that in our secondary survey. So we had to do a bit more work. We had to merge some similar questions. We also had to look at the language to make sure it was accessible and understandable. And that's actually one of the reasons that we chose the term body clock versus circadian rhythms. We had to make sure it was understandable, that it was engaging for people that actually wanted to fill out the survey. So I know the term body clock and circadian rhythms can be a bit contentious, but there was a reason we chose it. Colloquially, it's the best way to understand what's going on. So, we had to look at those 228 questions and figure out, have any of them been answered already by research and the public just don't know yet? So, we managed to do a bit more merging of summary questions, and we ended up with 171 questions at that point. Again, more merging, more looking at things. We decided to actually collect lots of the different mental health conditions that people asked about. So they asked very specific questions, similar questions about depression, bipolar, anxiety, OCD, PTSD, things like that. We made the decision to look at them as mental health conditions as a whole. We then managed to get down to 97 after our evidence check. Again, we cannot ask people to look at 97 questions in a secondary survey. We had wanted to really aim down between 50 and 70. We thought that's a reasonable thing for people to look at. And luckily, we got to 68. So, the next thing was our ranking survey. We needed people to tell us, of these 68 questions, what are the most important? What are the ones you really need to be looking at first? So, not the prettiest slides, but this is what our secondary survey looked like. It was a two-step process of looking through, selecting all of these 68 that felt important to you, and then subsequently choosing just 10 of your selected lot. So, from our ranking survey, we've got 315 responses. We had quite a lot of people that chose all the ones that were important to them and then couldn't tell us them. So we kind of had to chuck out some of those, unfortunately. But these things happen. Again, we had quite a lot of representation of people with lived experience of different mental health conditions, difficulties, and different disruptions to their body clock. Again, we had from 12 only up to 82 this time age-wise, but our averages stayed about the same. And again, the majority of people that did answer were women. We managed to get slightly further down the UK. We got all the way from Cornwall up to Aberdeenshire. So actually we went a lot higher than that. We got some Shetlands as well. Forgot about that. So we managed to span almost the entire length of the UK with this second survey. So, what questions were selected the most? Now, this is just to kind of show you the range of things that seem to be important. Some people, there was one particular question about hormones that was really quite popular, but then between all of that, this changed almost daily. Everybody had so many different priorities that were important to them. Some things did not seem to be coming out as important. Maybe we just didn't get people that went on very long haul holidays, because jet lag wasn't particularly a fancy question about that. But this changed a whole lot. Now, after some feedback from our steering group, we had to go to our top 25. That was the next step. We had to take all of these important ones and go down to 25 questions. And these are the 25 questions. So I'm going to leave this here for a moment. I want you to have a little nosy and see if you can guess what you think would be in the top 10, or what would be in your top 10. What would you think would be the most important to you? Everybody picked a favourite? Yeah? Okay. So, we were then going to take those 25 questions into a final workshop. One, to select the top 10, but also to rank the entire 25. So we do actually have a ranking of the top 25, but I'm going to share the top 10 with you today. So we took that to a final workshop. Our workshop was a mix again of people with lived experience of mental health difficulties and circadian rhythm disruption, carers, clinicians, clinical support workers, other forms of support were all involved in this workshop. It was a big, long day. There was a lot of discussion. Between our first two sessions of splitting the group up and asking them to rank, the two groups didn't agree. But it's fine, we went and did it again. By the time we brought everybody back together, the consensus was actually quite striking. So everybody did actually manage to agree on a top 10. So, drum roll please. The top 10 priorities for mental health and the body clock for research. We're going to go one by one. We've got time, right? So, does the interaction between mental health and the body clock vary by age, especially during different life stages? Number 2. What strategies, including medications, are effective in treating disrupted body clocks co-occurring with mental health issues? Number 3. What is the relationship between the body clock and mental health in neurodivergent individuals, and does body clock disruption worsen mental health in these individuals? Number 4. What is the relationship between a disrupted body clock and bipolar disorder, or between a disrupted body clock and psychosis? What are the mechanisms involved in this? Number 5. What societal and or policy changes can help prevent mental health issues for and reduce stigma towards extreme chronotypes? What is the relationship between perimenopause, menopause, mental health and body clocks? How does mental trauma affect the body clock? How can this be managed? Would it be better for a person's mental health to follow their own natural rhythms, or to follow more typical patterns and or societal patterns? What is the relationship between seasonal changes, body clocks, mental well-being and mental health issues? The last one, number 10, can mental health difficulties such as anxiety or depression cause disruption of the body clock at a molecular level, or are these driven mainly by behavioural factors? And those are our top 10s. I just want to say a big, massive thank you to our steering group members for all of the input they put into this project. A big thank you to everyone who shared, answered the survey, who came along to the workshops, that have been part of this process the entire way through. So a massive thank you to everyone that got involved, and a big thank you to you all for listening.